progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio.
Welcome to Palmdale Regional Radio. I'm Prakash Chandran, and today we are discussing VitalStim therapy with Ting Xu, speech-language pathologist and LSVT Loud certified therapist for Palmdale Regional Medical Center. So, Ting, it's really great to have you here today. I've been hearing about VitalStim, but I was hoping that you would just explain at high level what it is.
Hi, Prakash. Thank you for having me today. So VitalStim is a non-invasive therapy. We use electrical current to stimulate the muscles for swallowing. So it's a good therapy method for people who have difficulty swallowing. Okay.
And tell me a little bit about how it works.
So the VitalStim system, it uses a neuromuscular electrical stimulation to stimulate your nerve muscles, especially responsible for swallowing. So the device will shoot out the electrical currents. The currents were produced by the machine, and it helps to strengthen the muscles involved in the swallowing mechanism in order to rehabilitate the swallow.
Okay, understood. And before I ask who benefits from this, can you talk a little bit about where those electrical nodes are placed? Is it just on a person's throat or neck?
Yeah, so usually we will place the electrodes on their front of their neck, and then the machine will shoot out the current. So by stimulate the muscles, it will send the message to your brain and then strengthening your muscles, and then to coordinate your muscles and your brain connection.
Okay. And so who exactly benefits from VitalStim?
So for, as mentioned earlier, this kind of therapy is benefit for people who have difficulty swallowing, and it's more specific for people who have oropharyngeal dysphagia. It's their difficulty is because of their muscle weakness in their throat. For example, people who had stroke or who had progressive neuromuscular disorders, or people who had a neck cancer, especially they went through a lot of radiotherapy. The throat muscles are getting really stiff, very tight. The VitalStim therapy will help them to retrain those muscles and to rehabilitate their swallowing.
Yeah, that sounds fascinating. So how effective is the VitalStim system?
So they did a lot of research, and then this kind of therapy is approved by the U.S. Food and Drug Administration in 2001 for treatment for people who have dysphagia. So usually by doing the therapy, they will see a good result from between 6 to 20 treatment sessions. It really depends on patients' severity of their disorders.
Okay, understood. And before VitalStim existed, because you said that it was kind of approved in 2001, what were the alternative or traditional methods of treatment for this?
Yeah, so for traditional dysphagia therapy, we just do exercises. If you come to the speech therapy and you have difficulty swallowing, we'll do some, we call swallowing maneuvers or swallowing strengthen exercises. So by doing the exercises to strengthen your muscles. But after 2001, they have this device. So the device will just helping kind of assess you to have a better movement of your muscles. For example, you're going to the gym. You're going to work out more. So those kind of device will help you to give you some weight. Kind of if you're practicing your muscles, you're lifting some weight. So the muscles will give you some kind of strengthening to help you to strengthen your muscles.
I see. So clearly, as technology has progressed and medicine has progressed,
yes,
VitalStim is a much better option because it's something that doesn't really require any of that weighted technique. It's just something that you attach on your neck and it starts working over the different sessions. Is that correct?
Yes, correct.
Is there anyone that cannot receive VitalStim?
So we talked about this is good for people who have difficulty swallowing, especially in their mouth and their throat. But if their difficulty swallowing caused by their esophageal area, then it might not be a good fit. We will kind of recommend to see the GI doctor to fix the problem in their esophageal area. And then if they still have the problem swallowing, then definitely come back to speech therapy. And besides that, if you have very severe reflux, or you have a tumor or active infection around your neck, we don't recommend those patients to do the VitalStim therapy because the current, we just don't want those current to go through those tumor and to like agitate it or irritate the infection or the tumor. And also for people who have pacemaker and then some deep brain stimulators, like you can do it if you have pacemaker, but definitely double check with your PCP before you want to come to speech therapy and do VitalStim.
Okay, so we talked about the different VitalStim sessions. Can you just walk us through what a typical session looks like?
So a typical VitalStim session, each session, it begins by putting the electrodes on the front of your neck. So first thing, I will use an alcohol pad to clean your skin and then place the electrodes. So in the beginning, you will feel a little bit like tingling. You might feel like kind of like needles, like very light needles like pinging on you. And then once I increase the input, the sensation will be more like a tugging and pulling, that kind of sensation. And once you feel that tugging and pulling, that's the good amount of the input I would like. And at the same time, so when the device attach on you, I will start giving you some exercises or some food to trial. Because like we said, the traditional therapy is doing the exercises. So for VitalStim, the research shows that we can receive the most effective therapy from doing VitalStim and traditional therapy together. So if you're just doing VitalStim, we just attach the device on you and letting you sit in there, it's not going to help you the most. So besides the device, we'll ask you to do the exercises at the same time. So that way, it will help your muscles to gain more strength back.
Now, you talked about kind of a pulling sensation, but I have to ask, does it hurt at all?
No, if it goes really high, you might. But of course, we're not going that high. We will increase the input little by little until tell me okay, it's enough. Then we'll stop right there. The numbers, it doesn't matter because everybody's tolerance is different. So it really depends on how you feel.
Okay, that makes sense. So how long exactly does a treatment session last?
So we usually do it for an hour, but of course we will decrease the amount of time. Depends on people's daily condition. Maybe they're more tired that day, or they're maybe more sensitive to the current, the stimulation. So usually I'll do an hour, but of course I will cut the time a little bit shorter if needed.
So how do you go about diagnosing what area to focus on for VitalStim and how many sessions are needed?
Before the VitalStim starts, I would like the patients to go through, it calls a modified barium swallow study. So by doing that study, we'll be able to know where the weakness is, what are the areas that we can really work on. And by that study, we'll probably be able to kind of gauge, okay, I think by the 8th session will be okay. And after the 8 sessions, I will want you to do a repeat a video swallow to know if there's improvement. But the initial video swallow shows kind of severe, then of course I will add the time for 16 sessions or 15 sessions. It really depends on the need for each people, for individuals.
Yeah. So finally, are there any side effects that people should be aware of when it comes to VitalStim?
So the only side effect that I would say is just the skin irritation, because like I said, before I put on the electrodes on your neck, I need to use the alcohol pad to clean your skin to make sure the electrodes can attach it very well. But especially for men, if you shave your beard and then, you might get cut. So the alcohol might sometimes be a little bit painful if you put alcohol on your cut. And then also if I clean your skin too well, it gets kind of irritated and fragile too. So that's the only thing I would say that's the only side effect for VitalStim.
So just before we close here today, is there anything else that you wanted to share with our audience around getting VitalStim or considering it for a loved one?
Yeah, I would say if you start feeling like you have difficulty swallowing, you just feel like, especially during the mealtime, you're drinking, even though you don't feel you're choking, but you cough a lot, I would say that's kind of a sign of the food went down to the wrong way. So please reach out to your PCP and get a speech therapy evaluation So we'll have a better idea if you need a VitalStim therapy or not. So definitely reach out to your PCP and get a referral.
Okay. And just to be clear, as a layperson, PCP is your primary care physician. Is that correct?
Yes, correct.
Okay, fantastic. Well, thank you for educating us today about VitalStim. This has been really informative. Thanks, Ting Ting.
No problem. Thank you.
That's Ting-Ting Xu, speech-language pathologist and LSVT Loud certified therapist for Palmdale Regional Medical Center. And that concludes another episode of Palmdale Regional Radio with Palmdale Regional Medical Center. Please visit our website at palmdaleregional.com for more information and to get connected with one of our providers. Please remember to subscribe, rate, and review this podcast and all other Palmdale Regional Medical Center podcasts. And for more health tips and updates, follow us on your social channels. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. Thank you so much for listening. My name is Prakash Chandran, and we'll talk next time.